Hi, my name is Giles, and I'm happy to be able to talk to you all today about health communications. Here's a little bit of information about me. I'm a former anchor and reporter. I worked at KPTM Fox 42 here in Omaha, and then left television to do public relations at the University of Nebraska Medical Center. And now I'm at MSpace Group. We are a communications strategy studio, and what that means is that we spend most of our time working with clients that happen to be in nonprofit areas, health and wellness, higher education, and community initiatives, all that contribute positively to our metropolitan area. We are a team of 10, and that includes several services such as communication strategy and planning, communications analysis, idea generation, brand development. We work with messaging, message development, copy editing, and proofreading, as well as graphic design communications, digital communications, public relations, and social media strategies. And I happen to work on the public relations and social media team. What we do is called integrative communication strategies. So the idea is to take what we know as best practices and integrate the health information from public health professionals to create campaigns about health and wellness. We always like to start with what's called a creative brief, which is our awareness of a health challenge. What we do is research the topic, and that includes interviewing stakeholders. So we want to know what materials, what information is out in the community, what materials the organization has at its disposal, and then we develop strategies to meet those communications needs. Once we do a creative brief, we're very much interested in looking at our target audiences. This is where we drill down into who we're trying to reach with our messaging and our campaign. Are they males or females? What age group? Where do they live? Do they live in rural environments, or do they live in urban environments? And are they part of a vulnerable population? This could include children, it might include our seniors, it could include people who have low incomes or neighborhoods that are vulnerable with the environment that surrounds them. We are working on an indoor tanning campaign right now, and so we're looking at ways to encourage teenagers not to choose indoor tanning. So when we look at a target audience for this project, we might consider the primary audience being young females between the ages of 12 and 18, and then a secondary audience could be their parents, or particularly their mothers, who might have tanned or might be allowing their daughters to use indoor tanning. So after we do our creative brief, we've kind of figured out who we're trying to reach with the message. Then we try to come up with what the message is, and this is our message framing. So we want to identify what language resonates with our target audience. So we might do some research and think about what phrases, what elements are teenagers using today, what might be effective when we talk to their parents about indoor tanning. And this is really where public health professionals can help us in framing the information. So we want to be able to present information through a particular lens that would address our target audience. And what's really important is to prime that health information so that the group can positively receive it. So we need to think about, are we saying something in a negative light, whether we want to encourage people not to do something, or do we want to encourage people to move from walking to running, maybe taking that next step along their health journey. So some of the key things we want people to think about as we go through this process is, what is the problem, why does it matter, and what should we do about it? So thinking about the example with indoor tanning, we want to think about, well, what's the problem? Well, it could be that melanoma rates are rising in Nebraska. Why does that matter? Well, it could be because there are long-term health effects for individuals who are diagnosed with cancer. And then what should we do about it? Perhaps it's that we just need to raise awareness about the rising rates, and then maybe some options that teens can do instead of tan. And then we have to find the right spokesperson. So for this example, it could be a former model that used to tan indoors, or a parent that now finds herself with melanoma and she's in her maybe 30s or 40s, and it's something that she tanned throughout her teenage years and 20s. So it's really important to find whether it's a spokesperson in that arena, or maybe we're talking about a community initiative where perhaps the sidewalks are not connected around a vulnerable neighborhood. So you want to find a community activist, someone that's well known in the neighborhood, and maybe somebody who can talk effectively to stakeholders and city leaders. So after we have done our creative brief, we've talked about the target audiences. We've thought about our framing and our language that we're going to be using. We also make use of social marketing techniques. So these are techniques that commercial advertisers have used. So if you think about the brands that you know of, maybe Coca-Cola or Nike, these are the strategies that those companies use to encourage people to buy their products. Well, we want people to be encouraged to change their health behavior. So we use these techniques to do two things. We want to create an upstream focus and a downstream focus. So our upstream focus is on changing the infrastructure. So these are messages that we use with stakeholder groups or maybe city leaders to encourage policy changes that might help facilitate or make it easier for people to change their individual health behavior. And then the downstream focus, which is really primary prevention, where we focus on raising awareness and encouraging people to move between a health belief model from their awareness to cues to action to finally maintenance and implementation. So we create a brand. So as if we briefly mentioned large brands that you might know of, we try to create a look and feel of a project that could resonate with people. And that can include things like the logo, the typeface, the color, as well as the tagline or phrase that people might remember. So this is where our creative designers really get a chance to show their expertise and their skill. And so now I want to show you some examples of our work that include the creative brief process, our target audiences, looking at message framing and branding, and how everything is integrated into a successful project. And here are some samples of our work. The Douglas County Health Department received a grant from the Centers for Disease Control and Prevention to put prevention to work in our community. And here are some examples of that project. It included a healthy neighborhood store, which is an opportunity to address food deserts in North and South Omaha, areas that maybe didn't have grocery stores nearby where they had access to fresh fruits and vegetables. So we were able to work with the health department to do a great campaign around signage, videos, and information to let the residents in the community know that this was a place that they could go, their local neighborhood store where they can get healthy fresh fruits and vegetables. As part of that initiative, we also worked with the Workplace Wellness Program with Partners for a Healthy City. This was an opportunity for organizations to look at a menu of policy changes that they could incorporate to encourage their employees to be healthier. Things like taking the stairs or having access to water, or maybe encouraging people to ride their bikes to work by putting a bike rack outside the place of employment. The iRide campaign included a Share the Road component for people who would be biking to school or biking to work to encourage all of us, whatever mode of transportation we use, to be healthy in our environments. The Gretchen Swanson Center for Nutrition came to us with a rebranding request. So we looked at what they had existing and came up with this new brand for their website and for their printed materials. A lot of their focus is around nutrition, so encouraging people to think about where their food comes from, maybe investigating a CSA, which is a community-supported agriculture share, where you can buy from a farmer to get fresh produce delivered to your home or to your office. Ready for Recess was a wonderful opportunity to talk about physical activity in school children. This was evidence-based research on the availability of physical activity in schools and the availability of recess and how that impacts the child's day as well as their learning opportunities. So we worked with the researcher to develop a Facebook page, a web page, and to conduct several webinars to address our target audiences, which are parents, school administrators, teachers, and even staff who might be able to do some very quick physical activity exercises with school children during the day. EHA Wellness came to us for several years to work on their wellness program. So these are signs that include everyday teachers expressing different funny quotes that we have come up with. This is 2011, now you see 2012 and 2013. So this is another opportunity for our graphic artists to use copy and their imagination to create messaging around workplace wellness. And then finally, Liberal Omaha Kids. came to us to help them implement their family dining pledge and a lot of their marketing and social media as well. So we took the opportunity to create a wonderful dinner table that encourages family dining. We do an email newsletter so that parents can get recipes and fun tips about physical activity, events that are happening in the community, all in an effort to encourage families to sit down for dinner together, to cook those meals together, and to hopefully have a healthier dinner meal every night. So this is some of the work that we have done over the last couple of years. I welcome any questions about health communication and what we've done to integrate public health messaging into community initiatives. Again, thanks so much for your time.